I'm going to read this short article because it describes everything I've been saying for years now, and this is from PubMed. It was an article. It was posted on in 2018, titled, "What Happened to USA Healthcare on the Way to Socialism." Dr. Ghali correctly summarizes the state of medicine today in the U.S. in his essay, "What Happened to the Patient First and Do No Harm, Medical Principles." Well, this is everything I've been saying for years now. And he is exactly right. The real reason the changes have happened in medicine and healthcare is related to the centralization of control of healthcare services. Socialized medicine, yes, why all they monopolized, and then everything, we have to listen to the CDC. No, screw the CDC. No, it all needs to go back to the local. All the hospital monopolies need to be broken up by somebody, hopefully Trump. If it doesn't happen, then just put the CEOs in jail. Socialized medicine, which is the most important part of establishing communism. Can I say that again? Socialized medicine, socialism, which is the most important part of establishing communism or socialistic control over people. When you control their health care, you control their lives. Absolutely. Rush Limbaugh used to say this all the times, and the libs hated it. Well, he was right. Once the state gains control of everyone's health care, they control all the people. Yep. Next, they take all the guns away to protect bureaucrats and their self-appointed elite leaders from the collective uprising of the people. That is the central reason behind gun control. Don't you love this, doctor? To put power over the people in the hands of those who control the socialist system. There is no other argument than that which establishes complete control over the socialist system, or complete control over each individual than taking away their guns. The rest of the arguments are nonsense. There is abundant, listen to this, there is abundant evidence that when the people have guns, violence decreases substantially as everyone knows the next person has a gun. Thus, disagreements are resolved non-violently. It's shocking. This is a doctor. The elite then gain control of the press, education systems, and essentially all information people receive. Sound familiar? Societies and cultures are destroyed as immigrants overwhelm the country with radical beliefs, as in the European community, while socialism erodes its principles from within. Centrally controlled socialism then is established. Just look around and see how much of what I have described is in your country. As the U.S. government became involved in Medicare or health care for the aged, in the 1990s, under President Lyndon Johnson, it only added health care to Social Security and pensions offered by the corporations as settlements to communist-inspired union disputes. These benefits then became established entitlements. The people believed that the government owed them these entitlement programs as a right. These programs now have costs that go beyond what can be provided or promised by the politicians and political leaders to gain control of the people. Such a result happens when, as one would expect, in a system in which all the expenses are paid by a third party, not the user of services. Under such a system, no one cares about the expenses as someone else is paying the cost. It is, quote, credit card, end quote, medicine, with the credit card being paid by the government. Really, the people are paying, but they don't realize it. Nevertheless, their healthcare services decline, the cost rises, and delays in care occur with a shortage of drug and testing facilities. Quality and talented people choose other professions that are less regulated than medicine, so the quality of applicants for medicine decreases. The costs go up as more bureaucrats are involved in the distribution of the money collected by the government for healthcare. No centralized system of healthcare can determine the millions of individual demands in the marketplace for each patient. This principle is the fundamental failure in the economics of socialism. No bureaucrat can determine what is needed in every location in the USA or a country or town, as those factors are determined best by the local marketplace. This allows each individual physician an opportunity to achieve his or her best in providing care for the customer who is the patient. Since the locally controlled free market system was replaced with centrally controlled socialism, there had to be some way to determine what a doctor is doing for their government pay. So complex medical records were developed, with forms to be filled out that have little to do with patient care, but are used by the bureaucrats to control the doctors. Remember I said in past few videos, well, all we do is check boxes, and it's monotonous, it's stupid, it's ridiculous. Since the government, which now runs healthcare, does not know how to distinguish good from bad physicians, they instituted a system of payment in which all are basically paid the same for each operation. The only way the doctors could make more money was to develop more complicated operations, such as in spine surgery, for which their pay was rewarded at a higher level. Thus, the biomedical industry, which benefited from this incentivization to buy equipment, supported this system, so prices got higher for complex spine surgery and doctors made more money. The evaluation of these products against standard operations and against each other was not done, as it would have destroyed the incomes of the biomedical companies and show that much of the complex surgical equipment is unnecessary. This is a worldwide problem, so everyone is playing the system to gain the most money they can. You can see where this thinking will end with the corruption and eventual destruction of medicine as we know it. The system has failed in Russia, Communist China, most of Europe, South America, and now is failing in the USA. Free enterprise and free markets have never been fully tried in healthcare. Nope. Although the bureaucrats are quick to say that the free market doesn't work in medicine. Bullshit, again, as he said, not been tried. When the government entered medical care, they took away the doctor's right to perform x-rays, lab tests, and distribute drugs in the office. They gave that right to the hospitals. As one can imagine, the hospitals charge more for these services than the doctor. The government eventually gave the hospitals 3% over their costs for doing these tests and taking care of patients. Naturally, the hospital raised their charges to make more money under the 3% rule. So prices for care at hospitals climb at ridiculous levels as no one can see if he or she inspects a patient's bill today. And that's why Trump made it where the hospitals had to be transparent. Hospital administrators do not contribute to the health care of patients. Now they run the hospitals and control the money that is generated by physicians. Add to that more bureaucrats to run this complex centralized control system. That gives you health care today. It is doubtful that medicine will return to a free market system. So, not only in medicine, the result of socialism, not only in medicine, but in industry and other parts of the economy, will not change. Medical care is headed for a total failure as the costs get higher and the controls over doctors and workers by the bureaucrats limit what they can do and how they can get paid. Incentive to practice the best medicine is lost because it is not rewarded. The quality of health care is declining, as is the education of medical students under an increasingly socialized educational system. This system rewards outcomes and does not incentivize each individual to do his or her best. 100% true. What would it matter if everyone was paid the same in the end? So why work hard? I'm running out of time, so I'll just leave it at that. There's nothing good about where our healthcare system is at, and it's headed for complete destruction.